Hello everyone, Paul Martin here, and this is the situation for February 22nd, 2020. Thank you so much for watching. I realize it has been a while since I have posted a video. I go back and forth on what is the best way to get information out, information that I think many of you would want to read, want to consider, want to consume. I have not done one, however, with PowerPoint. I think this is probably going to be my preferred platform for future videos. You're not tuning in to see me. At least I hope you're not. I don't think you're probably going to be sorely disappointed if that's why you're tuning in. But I'm a visual learner, and so it's my hope that having this information on slides will be of benefit to you. So let's jump right into it. But first, let's go to our official sponsor for tonight, COVID19ready.com. COVID19ready.com. All the latest news and information that is reliable, that cites reputable sources. You can find it all here at COVID19ready.com. Visit it, bookmark it, share it with your friends. This is a website I started about a week ago where I'm just simply cataloging things that I read that I think may be of benefit to others. I'm not selling anything. There's no subscription. It's just a website. It's got a blog. It's got some information there. So if you are looking for the latest information, I try to keep it updated on a pretty regular basis. There's also some tips from CDC and some other places towards the bottom of the website. So check it out when you have a chance. Feel free to share it with others. COVID19ready.com. I want to cover four things with you in this video. We're going to talk about some of the latest news about the COVID-19 coronavirus. I'll share some of my concerns moving forward. We're going to talk a little bit about the CDC's guidance on how to manage a potential situation here in the United States. And then I want to spend a few minutes talking about steps you can take now. I've been getting lots of questions and emails, and people have been emailing me and texting me articles that they've read about this to keep me informed, and I do appreciate it. One of the things I like to ask people when they send me that stuff is, what are you doing in light of this? And the vast majority of people who've reached out to me don't have a plan, and I suspect it's because they don't know what to do. They don't have a sense for what they can do, what's possible. And I want us to spend just a few minutes at the end telling you there are some things that you can do right now, most of which are very inexpensive to do, to put yourself in a better place and be better prepared for the possibility of a more serious pandemic than what we are already seeing. So let's jump into it. Let's talk about the latest news. Folks, I can't even keep up with the news anymore. When I started tracking on this 2 or 3 weeks ago, maybe it's been a little longer than that. I've lost track of time. There wasn't that much news out there. Now my news feed, New York Times, Washington Post, The Economist, Foreign Policy Magazine, CNN, CNBC is just inundated with news about this. So I could spend an hour talking about this, but we're only going to touch on 4 articles very quickly. And by the way, I'll link to all of this information below so that you can go read it for yourself and share it with others if you see fit. But I want to spend just a couple minutes talking about 4 different articles. This article from CNBC that came out Friday, I think this is probably the most important article of the week. The headline is CDC prepares for possibility coronavirus becomes a pandemic and businesses, schools need to be closed. Now, I visit the CDC's website probably twice a day looking for updates on this, and I will tell you that they have changed their narrative from as recently as Monday of this week. What we're about to read below is a direct quote from the CNBC article. We're not seeing community spread here in the United States yet, but it's very possible, even likely, that it may eventually happen. This is the first time on Friday that I saw any news from the CDC alluding to the possibility or the likelihood that we will have a spread of community spread of coronavirus here in the United States. Our goal continues to be the slowing of the introduction of the virus into the U.S. This buys us more time to prepare communities for more cases and possibly sustained spread. The article goes on. The doctor quoted in the article points to China, where schools and businesses have been shuttered for weeks to contain the outbreak there, saying the U.S. may eventually need to do the same. meaning closing of schools and businesses. We may see that here in the United States. We're already seeing it beyond China as well. I think there's some people who believe that, well, those things happen over there to those people in some other country. They don't happen here. They will absolutely happen here. They can absolutely happen here. We are not immune from it, and we need to be prepared for that possibility. And it sounds like CDC is getting on that message. Now, I share this with you. I want to make it very clear. I am not criticizing Center for Disease Control. I think they have been put in and given an unenviable task of alarming people without alarming people. They are struggling. Part of the big problem, as you know, is that the Chinese government has not been forthcoming with information and data, and it is probably that delay has probably unnecessarily injured or killed a lot of people and has led to the spread of this disease because we simply don't know what's going on. And transparency is needed here, and the Chinese government is not providing that. So the CDC, I think, is doing the best it can. The good news is that, at least I think it's good news, the CDC is now saying we have a bigger chance of this coming here, and we need to get prepared. Moving on, New York Times headline, as new cases surge, businesses face grim fallout. One of the things that we have to be mindful of is not just the fact that people can get the virus, but those secondary and tertiary effects, second, third order causes of what the disease and the pandemic might cause in terms of harming the economy and disrupting our way of life. Quoting from the article, the coronavirus outbreak, whose breadth and duration remains disquieting, is forcing international companies across nearly every industry to face a stark reality. Business will not go on as usual. Auto sales in China collapsed this month, with the Chinese Passenger Car Association saying that sales at dealerships had plummeted 92% in the first half of February compared to the same period last year. China is the world's biggest car market by a wide margin, so a nosedive in sales causes pain. Think about what would happen in the United States if car dealers reported that they had a 92% plummet in sales in one half of a month compared to last year. Think about the impact that would make. It would be leading all the news stories. We would hear about it incessantly, and it would mean that there are other things going on in the economy. This is happening in China right now. We need to be aware of that. CNN, 59 Hong Kong police officers will be quarantined. 59 Hong Kong police officers will be quarantined after a 40-year-old male officer tested positive for novel coronavirus on Thursday, according to the statement released by the Hong Kong police. Now, think about this for a minute. One person potentially infected 59 people, not just 59 random people, but 59 police officers. Think about your community. If a large number of police officers were effectively quarantined for 14 days, which is what the article says below, what would that mean for police response times in your community? I don't know how big the police force is in Hong Kong. I assume it's large because Hong Kong's a large city. But say that 25% of your police force is quarantined for 14 days. What do you think that will do to police response times in your community? You need to be thinking about this. We all do. CNBC, DuPont ramps up safety suit production as coronavirus causes shortages in China. Thousands of DuPont employees are working around the clock to increase production of protective garments that are in high demand by first responders and medical workers in high-impact regions like Wuhan, China. Reports from China show workers are running low on safety supplies, including garments and masks. If they're running low in China, what do you think that means for us? What do you think that means for us when it's our turn to have a large influx of people reporting to emergency rooms and calling EMS and going to doctor's offices complaining of flu-like symptoms? We're going to have shortages as well. We need to be thinking about that. So I want to share a few concerns that I have. And the reason I share these videos and do this stuff is that my hope is that, I'm reading this information for myself. And it's my hope that by sharing it with you, you may find at least some of this useful for your own purposes as well. So I'm just going to share my concerns. If you don't share my concerns, that's fine. But I just want to give you some food for thought. Make sure that you've covered all your bases. First and foremost, we are not ready for a pandemic. If you think we are, or if you want to dispute that, just go on Google and say, "Are we ready for a pandemic?" Type that in, and you will see article after article after article after article by scientists and public health experts who will tell you we are not ready for a pandemic here in the United States. We're just not. So here's some questions I have that we all need to be asking ourselves and asking our spouses and our family members. Does your employer have a plan? And when I say, does your employer have a plan, do they have a plan to decontaminate the building, if the office space, if there's someone there infected? Do they have a plan to close the office? Are they going to pay you while the office is closed? Have you had that discussion? Has your employer said anything to you about that? Do you have a plan for childcare? If schools close because of a pandemic, and by the way, this is not some research project or some hypothetical question. There are schools closing all over the country right now just from garden variety flu A and flu B. I've seen a lot of stories in the news where schools have been closed 2 or 3 days. The schools get decontaminated. It gives teachers and gives parents an opportunity to get their kids healthy again. If your kid's school closed, what is your child care plan? If your kid's daycare closed, what is your plan for childcare? Are you going to have to stay home? Is there someone else that can take care of them? Start thinking about this. Are you prepared to shelter in place? You see those videos of China where, tens of millions of people are just basically told to stay home, and the streets are empty. No one's in the stores because they're all closed and because people are sheltering in place. Can you feed yourself? Do you have enough supplies on hand to stay in your house for several days, maybe a couple weeks? Who knows? Start thinking about that. Are you financially prepared to miss work for a period of time? What happens if your employer closes for 2 weeks or a week or whatever? Do you have the financial resources to get through that if they're not going to pay you? What happens when someone comes home and they are sick and someone's got to take care of them? By the way, folks, you've seen those videos. Most of you have seen those videos in China, people reporting to the hospitals. Our hospitals will be completely overwhelmed. Our doctors' offices will be completely overwhelmed. Our EMS system will be overwhelmed. Much of the care provided for a COVID-19 pandemic will be provided at home. And I'll explain to you why here in a few minutes when we look at the CDC guidance on this. You need to start thinking about how you're going to prepare to care for sick people at home. Good news is CDC has provided some ideas. We're going to get into that here momentarily. What if hospitals and professional responders become overwhelmed? The hospitals are overwhelmed. EMS is overwhelmed. EMS employees are sick. Hospital employees are sick from taking care of sick people. This could be a very serious situation here in the United States. It already is in China. It's already in Italy. It's already in South Korea, in Japan, and in a number of other countries. They are dealing with this. We need to start thinking about this as well. So let's talk now about the CDC guidance. Again, there's lots of good guidance on their website. I want to share a few things with you, get this on your radar so that you understand what we're dealing with. There's a document on the CDC website entitled Interim Clinical Guidance for Management of Patients with Confirmed 2019 Novel Coronavirus Infection. Go on the CDC website. You can read this for yourself. I will link to it below. Here's what, and by the way, this document is written for healthcare professionals. It is to provide doctors and hospitals and medical professionals with guidance on how to treat cases of coronavirus. You need to understand what the CDC is saying. I have quoted below the most important things that we all need to understand. There is no specific treatment for COVID-19 currently available. Clinical management includes prompt implementation of recommended infection prevention and control measures and supportive management complications, including advanced organ support if indicated. There are currently no antiviral drugs licensed by the U.S. Food and Drug Administration to treat patients with coronavirus infection. There is no Tamiflu. There is no other pill right now available to give to you if you get coronavirus. There's no silver bullet. You're basically going to be given fluids. You're basically given pain relievers, fever reducers, decongestants. There may be some other medications that in a hospital setting they may be able to provide, but folks, that's it. There is no coronavirus medicine that they can give you to make you well. You need to understand this. The CDC has a wonderful brochure on its website. I will link to it below, but I want to cover a few things that the CDC is telling people that they need to have on hand to deal with treating people at home. And this goes for just garden variety flus, but also coronavirus as well. Most of this you already know. Tissues, trash cans with lids and plastic lined trash bags, alcohol-based hand rub, that we're talking about Purell, plenty of fluids, plenty of ice to keep on hand to keep people hydrated, help reduce their temperature. Some people are going to be weak. They may not be able to drink out of a cup. Maybe they'll need a squeeze bottle or some straws to help them. Have a thermometer. I went and bought, a weird thing about oral thermometers, at least at my house, is that we always have them, and then when somebody needs one, I never can find one. So I got really irritated the other day when we needed one. My wife had flu A here about 2 weeks ago, and she needed a thermometer, and I just went to the pharmacy and I bought 3. So that way we always have one or two as spares. Have a thermometer, a humidifier. I will tell you this, speaking of my wife having flu A, she had the flu. She was complaining tonight. We went to a dinner with some friends from church, and she was telling me, I'm completely over the flu, but I'm still having coughing. My lungs hurt. It's if I breathe in really hard, if I breathe in a lot of air, I start to cough. I haven't really fully recovered. And she's at dinner tonight talking to another lady in our church who also had the same flu A, who's experiencing the exact same problem. So a humidifier would be something that we probably need to have here on hand. I don't have one right now, but we probably need to get that to help in rehab for no other reason. And then face mask. And you've probably read a lot of things about the face mask. Oh, the face masks don't help. Don't get face masks. Don't hoard the face mask. Blah, blah, blah. Everything I'm read is that their medical professionals are wearing N95 face masks. If you can find some face masks and you can afford to buy them because they're really expensive, relatively really expensive, you should have a few on hand. If you don't, it's okay. It's not the end of the world. The primary use of a lot of these face masks is to give to sick people so they're not breathing out their cooties and germs into the air. By the way, on face masks as well, I didn't link to this because there's just too many articles out there. But now we are seeing reports where, in addition to the virus being transmitted through the air, through respiration, exhaling of the virus, there has been some links to fecal to oral contamination, meaning people don't use proper hygiene when they go to the bathroom. They put their hand on the doorknob or counter or whatever, and then somebody comes along, touches it, and gets it into their mouth because they're eating or whatever. This sort of thing happens all the time. People don't use good hygiene. We generally just don't get sick of it, but now we're seeing reports from China that this is a new transmission vector. So be very cognizant. And so when we talk about washing your hands thoroughly for 20 seconds at least and using a good soap, that's what we mean. That's the reason you need to do that. All right, let's talk about steps you can take now. Most of this stuff is not expensive. In fact, none of this is really expensive. Some of the stuff you can do for free or close to it. But you can start putting yourself in a position to be better prepared in the event something like this happens in the United States. So 1, follow the CDC guidance and have the supplies ready. I've given you the list of supplies. I'll link to it below. You know what you need. Again, none of this is really expensive stuff. Other items I would suggest you have Pedialyte and or Gatorade for electrolytes, rehydrating people. Having food and beverage at home in case you cannot go to the grocery store or the grocery store is closed or there's a quarantine or whatever. Have enough food on hand. I mean, this is just like any other preparedness thing I would be talking to you about. Have food and beverage on hand to shelter in place for a period of time. Cash money. Have cash. If you cannot get to the ATM, maybe the banks are closed, and you say, oh, the banks will never close. The banks are closed in China right now. I've read article after article about how people cannot get access to their money because the banks are closed. If your bank is closed and everyone's drained the ATM, where are you going to get cash? Get cash now. And have, when I'm talking about 6 months of your salary, I'm just talking about, several $100s. If you don't have several $100s, just do what you can. Have some cash available for an emergency should you need it. Keep your car gassed up, and if you have, if you're like me and you've got a propane tank, keep propane in your tank. Get your tank topped off. I had this done the other day, not because of coronavirus, just because it was time to do it. That would be a bad time to run out of propane. It would be a bad time to run out of gasoline. Get in the habit of keeping your car gassed up in case there is some sort of disruption to gasoline delivery in your community because of this potential pandemic. Clorox wipes, some sort of wipe that kills both bacteria and viruses. Remember, it's called coronavirus. And I see a lot of wipes and a lot of people buying wipes that are antibacterial. They're fine, but if it's antibacterial and the label says nothing about killing viruses, it won't kill coronavirus. You need an antiviral type solution. Clorox wipes, other wipes will do that. Just make sure to read the label, make sure you know what you're getting. Hibiclens, this is a soap. You can buy it at Walgreens. You can buy it on Amazon. It is not cheap. Runs you about $30 a gallon. But this is an antibacterial, antiviral soap. Surgeons use this to wash their hands with before they perform surgery. You can get it now. Get it now. Bleach. Get bleach. You can use bleach, and I'll link to my website. There's some formulas on there about how to create a disinfectant if you needed a larger scale disinfectant. You didn't have any Clorox wipes. Bleach has a lot of uses. I suggest you get. You don't have to get a lot, maybe a couple gallons, just to have on hand. Top off your consumables: toilet paper, paper towels, feminine hygiene products, hand soap, cough drops, non-latex gloves, laundry detergent. These things are available right now, but I will link to my blog again at prepperdepot.org. There are some reports in the LA Times reported, I think it was 2 weeks ago or a week ago, again, I've lost track of time, where they have had major disruptions in toilet paper, paper towels, certain food items, because there's been a run on supplies. So you can get these items right now relatively easily. I would suggest you go and stock up on some stuff. And again, you don't need 10 years supply. You just need to have some extra on hand in case there are shortages. On the hand soap issue, one of the things I like to keep on hand for all sorts of emergencies is just good old-fashioned generic baby shampoo. You can wash your hair with it. You can wash your hands with it. You can use it as a body wash. It is dirt cheap. It works really, really well. I keep a lot of that on hand. I rotate through it. It is good stuff. Highly recommend you have some of that on hand. All right, so the CDC has made some recommendations on medications that you should keep on hand. It's in that fever brochure that I'll link to below. I want to point out a couple of things here. These two right here, acetaminophen and ibuprofen, these are recommended by both the CDC as well as the Mayo Clinic for pain and fever control for flu. Aleve, however, is not recommended. It was not on their list. I can't say they're not recommended. I did find a number of reputable websites that say Aleve is fine. I put Aleve up there because I have a better result with Aleve for pain and fever control than I do with Advil. But go ahead and have this stuff on hand. Now, I am not a doctor, but I'm telling you to have these things on hand so that if you get sick, you call your doctor and your doctor says you should be taking X, Y, and Z. You can tell the doctor, here's what I have on hand. What do you recommend that I take from this group of medications? Get this now before there is a run on it, because you know what is going to happen. If we have a pandemic, and I really don't want us to have a pandemic, obviously. It's going to be terrible for a lot of people, and I pray for these people in China. I hope you are praying for the people in China. I hope you are praying for the first responders, the medical community in China. It is just horrific what they are having to deal with it. But there's going to be a shortage. If we have a pandemic, there will be a shortage. Everyone will be running the grocery store. They'll be going on Amazon Prime, buying this stuff, and you won't be able to get it. Get it now while it is available, while it is relatively inexpensive. Decongestants. This is your Mucinex. This is your Sudafed. I will tell you, I picked up some Sudafed today at my grocery store, and I went online just to read some reviews about this particular type of Sudafed from Amazon, highly rated. However, Amazon did not have any available. My grocery store did. I stocked up. Note from the CDC, you need to consult with your pharmacist because decongestants are not indicated, should not give these to children under the age of 4. Also, children under 18, do not give them aspirin. Again, this is CDC guidance. This is not Paul Martin. Paul Martin is not a physician, but this is all from the CDC website. Do not give aspirin to children under 18. Do not give cough or cold medicine to kids under 4. Have medication specially formulated for children. Have children's Tylenol. Have children's Motrin. I bought some children's Motrin and Tylenol today. We have no children living here at our house, but I wanted to have it on hand in case someone in our family, our friend group, our church group runs out, or has a situation where they cannot get it. At least we can help them somewhat. Folks, so much of this is just being prepared, not just for yourself, but to help others, to be a blessing to others. I hope that you are taking this to heart and that this isn't just about you. This is about putting yourself to be a leader and a blessing and a resource to people in your sphere of influence. Plan your sick room now. If someone's going to get sick, where do you want them to be? I think the best place to put somebody is in a bedroom that has a bathroom attached, as opposed to having that person having to go down the hall and expose other people in the house. Make sure your family and friends are taking action as well. Call up your parents, call up your brothers, your sisters, your neighbors, your friend group of your kids. Talk to those people. Make sure, at least encourage them to start taking some action and getting better prepared for this. If you have children who have daycare needs, you may want to start thinking about what your alternatives are. Just at least have a plan in your mind. Start having those conversations. Make sure you're staying healthy. Hydrate, sleep, take care of yourself. Discuss vaccinations with your medical expert. If these are an option for you, go ahead and get your vaccinations. And then prepare for extended response times for public safety responders. If you're calling the police, if you're calling the fire department, if you're calling EMS because of whatever, and we have shortages of people, of these staff, please know it may be a while, maybe even longer than you're used to. Plan accordingly. Finally, I'll continue to update COVID19ready.com as well as prepperdepot.org to keep you folks advised, and I'm just basically sharing information I'm coming across with the hopes that maybe it's of help to someone else. So I'm happy to do that. Folks, I know this has been a long video, but there's just a lot of information, a lot of questions around out there. I hope some of this has been of use to you. As always, I appreciate you watching. Thanks for watching. God bless America.